Procedure for a wet-to-dry dressing change. First, verify the order. Verify hospital policy and gather equipment. In this case, for the dressing change, you would need your sterile dressing tray, a pair of clean gloves, a pair of sterile gloves, some normal saline, tape, your goggles, and a pen. Next, you would enter the room and identify the patient using two identifiers. Notice that she is comparing the armband with the patient name, date of birth, and medical record number to that same information on the chart, making sure that it matches exactly. Next, allergies will be verified using the chart and the armband, as well as asking the patient if he has any allergies. Next, explain the procedure to the patient and provide privacy. Position your trash can and perform hand hygiene. Raise your bed to a comfortable working height. And lower the side rail. Apply your clean gloves and don your goggles. Position the patient comfortably and expose the dressing and the intact suture line. Allow adequate workspace while maintaining privacy. So you would want to be sure to move the linens and the gown enough out of the way so that you would not contaminate your dressing during the procedure. Remove the tape gently, pulling toward the suture line. Carefully remove the secondary or outer dressing, turning away from the patient, and assess the drainage on the dressing. Assessment would include color and amount of secretions and odor. Remove the inner or primary packing using your gloved hand and place in the dirty outer dressing. Dispose of dressing and gloves appropriately. The dressing will be rolled inside of the clean gloves, pointing down toward the garbage can. Observe the appearance of the wound, making sure to notice any redness or swelling and drainage around the peri-wound area and inside the wound, and also notice if there is an odor. You are now ready to prepare your sterile field on the clean surface of an overbed table. Make sure you follow the principles of sterile technique here, opening the sterile field away from you first and then towards you last. And notice how you can rearrange the sterile field to give you more room on the table. Check the expiration date on the saline bottle and open the sterile saline using appropriate technique. So the cap is placed with the inside up. Now, to don one sterile glove. Notice how the nurse has left plenty of room at the end of the overbed table for donning gloves, making sure there's no chance of glove wrapper going over her sterile field. Arrange your supplies on your sterile field without contaminating the items. You will be using your sterile hand for this. Keep your sterile supplies well away from the 1-inch border. Remember, if your sterile field is hanging off of the table, the part that is hanging off the table is no longer considered sterile. Some of the gauze will be used to wet as wet gauze with saline. Some of the gauze will remain dry for drying the wound and as part of the dressing, and then the ABD pad will be left dry. Now, pour the sterile saline over the gauze dressings, holding the label in the palm of the hand, being sure not to dampen the sterile field as you pour, and also notice that the bottle of saline is not touching the sterile field. Recap the saline. Don your second sterile glove. Holding the gloves well above the glove wrapper, so you won't touch the sterile border, the unsterile border, or the saline, or the curtain, or anything else that could possibly get in the way. At this point in the checkoff, you will be asked to clean an intact suture line. You will do this by squeezing out the gauze and folding it in a manner where the gauze touches the wound but your sterile gloves do not. Then you will clean the wound by moving from an area of least contamination to most contamination and properly dispose of the used gauze, being careful not to drop your hand below your waist. Each time the wound is cleaned, you will use a sterile gauze, and this will continue until the wound is completely cleaned. Now we will move at this point to packing an open wound. Using the 4x4s that are soaked with saline, squeeze out the excess saline and fluff the gauze. Fluffing the gauze makes it easier for packing and more excess solution and fluff the dressing for packing. Avoiding touching the peri-wound area, pack the gauze by feeding it from the sterile hand into the wound. Use as many gauze pads as necessary to fill the entire wound bed, being careful not to pat the wound bed tightly or leave any gauze on the peri-wound area. So notice how the nurse is controlling the gauze in one hand while packing with the other hand, enabling her to avoid touching anything unsterile with the wound packing. Now you may gently dry the peri-wound area. At this point, take a sterile, dry 4x4 and place over the wet gauze packing. And cover with an ABD pad. Being careful not to touch patient gown or linens as you place the ABD pad. Properly remove and dispose of sterile gloves. Always making sure as you remove your sterile gloves that hands are pointed downward towards the garbage can. Secure the dressing properly. Notice how the nurse measures the dressing and then tears the tape, allowing for patient comfort. Tape the dressing in such a way that all edges of the dressing are taped in a window frame fashion. Write the date, time, and initials on the tape and apply to the dressing. Reposition the patient for comfort. Dispose of your supplies. And perform hand hygiene. Before you leave the bedside, make sure that the patient's bed is in the lowest position and the side rail is up. Return to the nurse's station for documentation, which would include the appearance of the open wound as well as the appearance of the closed wound. You would note the amount of drainage, the characteristics, and the patient tolerance of the procedure. This concludes the wet to dry sterile dressing change procedure.